numerous NIH and foundation-funded studies advancing brain circuit therapeutics. The author of more than 600 peer-reviewed publications, Dr. Okun's research has shaped clinical practice guidelines and expanded the understanding of Parkinson's disease pathophysiology and treatment. He is widely recognized for integrating patient-centered care with cutting-edge neuroscience to drive global innovation in the field. In 2015, the White House recognized Michael as a Champions for Change for Parkinson's disease. I would like to thank Dr. Okun for joining us today and also thank him and Cleveland Clinic for providing copies of his new book to every participant today. If you have not already, please make sure to pick one up from the exhibit hall. He will be here signing them until 11:30 today. Welcome, Dr. Okun and Dr. Walter, and the two of them are going to have a little chat for us.
Good morning, everybody. Well, thank you, Dr. Appleby. And I'm Dr. Benjamin Walter. I'm the section head of movement disorders here at the Cleveland Clinic. And as she said, we're very happy to have a good friend of mine and very famous neurologist now, Dr. Mike Okun, here with us, who's the author of this wonderful book, The Parkinson's Plan, A New Path to Prevention and Treatment, among many other books. And I understand this one is a New York Times bestseller. Is that right?
Because of you all, it hit the New York Times bestseller list, and it was an instant bestseller, and we need to raise our voices. And so we like to think of it as more than a book. It should be a movement. It should be something that we should be thinking about doing. So yeah, and thank you for having me here. Ben and I have known each other now probably 25 years or longer from Emory days.
Longer than
so. Yeah, so
I want to know how long it has been, actually.
So, but I will just say, just it's wonderful to be here in Cleveland. I'm always so impressed. I was telling Ben with the number of people that come out, and your voices are so important on this journey. So thank you so much for coming out.
So speaking of movement, today is an event really about moving and empowering all of you and all of us, everybody who is fighting for change in Parkinson's, to take control of this disease, the symptoms, and what it's doing to you guys, to families, to our communities here and across the world. And there's a lot that you can do, and there's a lot in this book, and I think we're really happy to have Mike here to go through some of the details with us. What's important in the plan here, and where do you get started?
Yeah, so well, first let me just say that when we started writing for persons with Parkinson, it turns out when you're a scientist that you're kind of in your own world, and you're not really seeing, the perspective of how many people are affected by diseases, particularly when you work in medicine. And so we wrote a book back in 2013, and it was called 10 Secrets to a Happier Life with Parkinson, and it had 10 things that you could do to help your life with Parkinson. And I learned a couple of lessons. One lesson was that more people have read that book than all the hundreds of papers that we wrote by probably a multiple of 10. Okay, so you assume that people know everything that you do, and because we don't communicate really well. And so it was a great lesson for me, and that's really when I first started writing, for groups that are beyond, sort of the erudite, the chosen few that know how these things work. And so we wrote Ending Parkinson's Disease in 2020, and when we wrote that book, we were talking about, what do we need to do to catch up to diseases like HIV and diseases like cancer. And we had said in that 10 Secrets book, in the prologue, we used 2 words in the prologue of the book: Parkinson pandemic. And people went nuts when they said, Parkinson pandemic, you can't say that. That's crazy, right? Then the next book comes out in 2020. We have this study that's funded by a foundation called the Gates Foundation, the Bill and Melinda Gates Foundation, called the Global Burden of Disease Study. They looked at how fast Parkinson was growing, and they realized, we took that data, and one of my co-authors, he's my little brother, Ray Dorsey. He's actually 1 foot taller than me, so you're getting the shorter version of the duo here. And so my little brother is really good at math and statistics, and he took those numbers. He used to work for McKinsey before he was a Parkinson neurologist, Ben, and he took those numbers and calculated by 2035 there would be 12 million people with Parkinson. And then everybody went, oh my gosh, we do have explosive growth here. Fast forward to this book. You asked me about this book. Where are we today? Another cut of data came from the Global Burden of Disease study. We've actually already made it to 11.8 million cases of Parkinson. We're 10 years ahead of schedule. We're growing faster than Alzheimer's disease. And so why write the book? Because there's some urgency that we need to do something not only for the people that have Parkinson, but we're going to have to level this growth out.
Yeah, so counting those numbers and understanding the scope of the problem is obviously really important for both getting people to take note of what's happening, but also to understand where the risks are. So what have we learned, and how real are those numbers? Like, what's causing the growth of Parkinson?
Yeah, so it's really important to be skeptical, okay, when you look at science and you look at numbers. And so we did an interview with Todd Zwillich on a show on NPR called 1A. And when we were talking to Todd, well, the first thing was he told us before we went on, he studied neuroscience in college, and we thought, oh gosh, we're in trouble here now. We're talking to a host that really knows something about the brain and about science. But we had a really great discussion, and we talked about how Ray, my little brother, gets really excited about things, but his job is to convince me because I'm the skeptic. And I've been in the lab my whole career, like Ben, studying circuits and things. And it's really important when we look at those numbers to convince ourselves that those numbers are rising, and they're rising not just because we're aging and not for other reasons. And the greatest risk factors for Parkinson disease are being a man. So, sorry to everybody who's a man in the room, but more men than women with Parkinson get it more when you age, but you also can get it at all ages, as a disease. And so once you factor in all the other things, it turns out the numbers are still exploding. They're still going up, and the growth rate, the rate of change is really high. And so I think we have to be skeptical, and we have to look very carefully, and then we have to ask why. And so in digging into why, we ask the question, well, could it be the genetics, right? And so the genetics of Parkinson disease, we know a little bit about. So here at the Cleveland Clinic, they have a Center of Excellence for Parkinson disease, and they have a really wonderful genetics program run by Nacho Mata, and who's an incredible scientist. I met one of the people from that lab here earlier today. And it turns out that the Parkinson genes have been studied by something called PD generation. And they have done, I think, like 20,000 cases all over the globe now. And they know the 7 most common genes for Parkinson, only make up about 13% of Parkinson disease, okay? And, shocker, you can have a gene but not actually get Parkinson. And so the most common risk is the GBA1 mutation, and 90% or so of people that have that don't get Parkinson. And LRRK2, the second most common, only 30%. So genes are not what's driving it. And there's been a lot of news lately about autism in the news. This morning on social media, I was reading early this morning a paper that came out in Nature about autism. Autism is very heritable. 80% are associated with genes. Parkinson, not so much. And then we have to look toward environment. Like, what are the environmental things that could be influencing it?
Yeah, so in the environment, this book goes into a lot of detail about water, pesticides, chemicals. What can you tell us about some of that?
So when we start to drill down, and we tell a lot of stories of people. So we've met a lot of people. I met a lot of you this morning too, which was really great. And when we get out, we start to realize that for many years we've been out treating folks, and they come into the clinic, and I know Ben and I used to do this 20 plus years ago, where they would say, a whole bunch of people in my neighborhood all have Parkinson, and they're all in this cluster. And we used to say, that's not related. That can't be, right? Mm-hmm. And now we're starting to say, not so fast. for those of you that watch SportsCenter and Lee Corso, not so fast, okay? It turns out that, that these clusters of cases are telling us something. And so in the book, we dive in, we tell the stories of multiple people that have been exposed to things. The book opens up. Those of you that are veterans, I met some veterans this morning, higher prevalence of Parkinson in veterans. We tell the story of two young women, Jana Reed, Sarah Whittingham, young onset Parkinson, both went to the academy together for Air Force, both stationed in many of the same places, both got Parkinson young onset within a month of each other. And these stories that are, I think, really important for us to reflect and say the why. And so now we know, so our food supply, so we think about, pesticides on our food supply. That's one way that we can, increase our risks of Parkinson disease. So that's food, air, breathing in, okay? So the nose is the gateway to the brain, okay? And water. And so thinking about those three things is really important. And I would remind people that the genesis, the beginning of this story that we tell is all about the Industrial Revolution. And for those of you that read about Parkinson, you probably heard about this guy, James Parkinson, who wasn't a neurologist, he was a surgeon. And he saw a couple of people from the streets of London in 1817, or just before 1817, before he writes this essay. Some of them had Parkinson, some of them didn't. They had all these different symptoms. It's a wonderful description, okay? And Parkinson disease begins to explode as a phenomenon. What was going on in the world? Industrialization. Yeah. We industrialized, and when we industrialized, we didn't do it because we wanted to create health problems for people down the road. We did it to create jobs. We created pesticides, side means killer, to kill the fungus, the bacteria, the insects, so we could have a better food supply and we could feed this expanding world. But at the same time, our water supply got contaminated, our food supply gets contaminated, our air becomes polluted. You know what was going on in Britain with the fog. And diseases began to appear or amplify in the past. And so we have to think about what's the environmental influences that are driving disease. And so we ask that question, and I would say to everybody here, we should all be skeptical, but we should ask that question, what's driving the disease?
So what is driving?
Yeah, so if you look at it, it's clearly not genetics. Yeah. Genetics in some, but actually even if you have a gene being exposed to to bad air, bad water, and to pesticides, those things can dramatically increase your risk of getting Parkinson disease. And so when we begin to look at the environment, we ask ourselves, are some of these things that we're doing unnecessary? And if we remove them from the environment, could we level the cases of Parkinson disease? And we'll only know that answer, folks, if you all raise your voices and get involved and actually do this. There is every reason why it hasn't been done, and that's because when we do a clinical trial, and Dr. Walter and Cleveland Clinic, and they give you all the access to all these new things, they will tell you the risks and benefits of what this is before you do it. If you're a chemical company or if you're a pesticide company, you're not held to the same standard. And I can't take half of the room and randomize you to get a pesticide called paraquat and the other half to not get paraquat. I know the other half will sign up, but the first half, I'm not sure that they would do that study, right? We can't do that. That's not ethical. So the way we're going to get the answer, Ben, is by removing these things. And in Europe, they've already started to do that. They're starting to see leveling of cases in the Netherlands. They're starting to see it in Germany. There's some new data coming out of Britain. So if you take a pesticide like paraquat that we know is associated with Parkinson disease strongly, it's banned in over 30 countries now worldwide. It's more than doubled its use in the last decade and a half here in the United States. And in Britain, they manufacture it. They won't give it to their own people, but they ship it to you here in the United States. And so we have to think about, I think, these things and trying to eliminate the factors that may be driving this growth.
So what about the treatment? What about what we can do and what they can do to help prevent and also treat? Where's the hope coming from?
So the plan, so first of all, let me just say that the plan, the P stands for prevent, okay? The L in the book says learn why. We need to understand why it starts, where it starts, how it spreads. If you don't get to the core root cause, diseases have root causes. Hippocrates taught us this and talked about the sins. A lot of daily sins add up to a disease. Hippocrates, right? And so we have to think about why, and we have to think about the beginning, the genesis of the disease. We can't look, there's a lot of parables that talk about the rivers in Eastern medicine, and you're at the end of the river, right? And so the person or the animal is dead at the end of the river, and you say, oh, they must have hit their head on that rock at the end of the river, right? And nobody goes upstream, right, to see what's up there. So we got to go upstream, so that's the L. The A is the amplification. We have to change the way that we are providing care for Parkinson. We're doing it wrong. We need a new model. Okay, so we call for a new model. And the N is the navigation of new therapies. And when we think about new therapies, we have to rethink. So we use a lot of R words in this, in this book. So we have to rethink, we have to repurpose, we have to think about 12 million people with Parkinson today. And then we have to think about what is our short, medium, and long-term goals. And we can't overpromise people. We promised people the stem cell delivery 25 years ago. It hasn't been delivered, but maybe we can rethink the way we're going to use stem cells for memory and thinking and dementia and regenerating those circuits. We have to rethink how we're using gene therapies. There's a great new area of medicine that's exploding called nanomedicine, so we can go smaller and get things to the brain. The brain has like a force field on it, so you have to beat the force field in order to get the therapies there. And so I think we have to be smarter, but we're not investing enough, Ben. We're not investing enough in Parkinson, and so we need a plan to put the right investment and to put it proportionally in the right areas in order to move the needle.
So I think what I'm hearing from you, there's certainly a lot that individuals here with Parkinson's should be doing today for themselves and for their family and for their care partners. There's things that we need to do for our communities, but also really to get anywhere, it's more at a national, international level to understand this problem better with a lot of data from across the world, but also to start impacting this pandemic in this country and around the world. And how do we navigate through that?
Yeah, so it's a great question. And so, first of all, I should say within the book, in the middle of the book, you're going to find the Parkinson 25. And these are 25 things that you can do and that we can do. And they're easy things, with or without Parkinson, but things that we can be doing. And so I would say things like getting a water filter. Okay, making sure that you're drinking out of a carbon water filter, right? Super important, okay? Especially if you're living close to a golf course. You saw that. I got more emails about that paper and the golf course, Ben, than in my career. I mean, emails, texts, people saying, oh my gosh, I can't play golf anymore. And that's not actually what we're saying, but living close to a golf course increases your risk of Parkinson. Why? Environmental exposure, so protecting yourself. So having air purifier in the house, having carbon water filters is super important. Exercise is super important, and really I know it's very well stressed here. There's a lot of information about 7,000 steps a day, 4 20-minute walks a day is huge for reducing not only cancer and cardiovascular risk, but improving Parkinson disease too. And if you can't walk, you can do recumbent biking, or they can put an exercise cycler in front of you. But moving is so important for the disease. So is sleep. And so making sure we do those things right. But I would say that if we don't have a path forward and we're not thinking proportionally how other diseases did this, we're not going to get there. And so in this book, we've interviewed a lot of people. I think it's a fun book to read, you'll tell me. You're happy to write reviews on Amazon or whatever your things. But we tell the stories of a lot of people, and it's very real. It's a community disease. We all have to get involved. But I like to tell the story of my son, who is now 17, but when he was in 2nd grade, he played a lot of chess. And he must have come out of the womb knowing how to play chess. Couldn't do math, but he could play chess. And so he was on 2 national championship teams. And when he was in 2nd grade, we were playing chess before bed, and he beat me the first game. He beat me the second game, and then and I thought I was a pretty good chess player. I actually retired at the end of that night from chess, all complete. I don't know if I played a game since then. And then the third game, he stops and he says, Ben, he says to me, he says, Dad, you know what your problem is? And I said, Jack, no, what's my problem? And he says, you don't have a plan. And every time I sit down to play you in chess, I have a plan and I beat you every single time, okay? I'm sorry to say in Parkinson's disease, we don't have a plan, but we can get a plan. And so we actually studied in both ending Parkinson's disease and now in this book, multiple other conditions. HIV has done it better than we've done it. Certain cancers have done it better than we've done it. Polio's done it better. And we need to learn from those and get the plan. And the plan is gonna call for some bold things. One, we're gonna have to have a plan that levels the growth of Parkinson by 2035. So we have to be bold and we have to go out there and say, let's remove some of these environmental toxins, see if we can remove that. Two, we're gonna increase our funding by at least 10 times. We only spend $250 million in the NIH right now. We're gonna need $2 to $3 billion. And then we need to proportionately spend that money across the 4 areas of the plan: prevent, learning why, amplifying, changing our care models, and navigating new treatment. $750 million each into those in order to move that needle. We're just not putting enough in, we're not advocating enough, and that's why we want to get everybody to join the PD Avengers, pdavengers.com, and create that grassroots movement that was born from the last book that we wrote. So if you haven't registered for that, register for that group, because we've got to do that. And the last thing we boldly call for in the book is dopamine for everybody. 2/3 of the countries around the world don't have access to dopamine. We were in Italy at a meeting, talking about this. World Health Organization is super involved in this. And why should we be able to get HIV drugs to everybody, but we can't get Parkinson drugs pennies on the dollar, but these expensive cocktails? Why should we be able to navigate people with HIV well through with care navigators, making sure that you're not just lucky to get parking and see one person and get an appointment, but getting the right teams of people together around you? So we need to be doing that more aggressively, and we need to come together with a plan.
Yeah, this is a wonderful book to read, and I have to say, the stories in here are amazing. You guys really went through and interviewed a lot of people in a lot of details, and there's a number of people in here that I know, just being in the Parkinson's community and working with a lot of researchers and clinicians as well. There's a lot of names in here, and the stories still are amazing to me because it adds so much color. The things that I didn't know about them, and there's people that I didn't know that there's wonderful stories about that they didn't realize different areas, because you guys have gone into tremendous depth both in the science, but the stories that wrap around just the developments that they've made. Because I have known each other since Emory in 2002, 2003, and even some of the people we work with there now that we're researching Parkinson's disease have Parkinson's now from some of these chemicals that we're talking about. So it's really interesting to see those stories. You make a point about HIV, and I thought that was a really good example in the book as far as the amount of money and what it took innovation-wise in this country and around the world to come up with really good treatments for this really deadly disorder, and how it compares to Parkinson's disease. And I think that's a good illustration for how far behind we are and where we need to be. Can you talk a little bit about that as we set the stage for the kind of action that really needs to happen on a national level to make a dent in this?
Yeah, absolutely. And let me just say that the stories are most important. Those of you that met this morning, many of you that I got the opportunity to meet, do you know what I asked you? What's your story? And so learning what the stories are is the fabric of life and how we're going to make change. When Ben and I were interns, the hospitals were filled with this disease called HIV and AIDS, and it was a death sentence, and people were scared, and practitioners were scared, people were scared, and it was an awful chapter in healthcare. However, they came together. The U.S. government, through the National Institutes of Health, after much advocacy, they had sit-ins. They sat in at the FDA. They closed down Wall Street, because the drug companies were charging too much for the cocktails. They took over the National Mall. They pushed Anthony Fauci, to listen to them. who was the head at that time of the National Institute of Infectious Diseases there. They were real advocates, and they pushed the amount of money in that they needed, and they got a plan. And that plan was so important. And not only that, internationally, they got the drugs to everybody that needed them. They began to get the care to everybody that needed them. And now HIV went from a death sentence to a life sentence. Now, I mean, it's a complete change over. Similar story of things that can be prevented happened in Guam. We tell this story in Guam. The people there were occupied during World War II by the Japanese. They were hungry. They needed to eat. There's a seed on the island of Guam called the cicad seed, but you have to prepare it for several weeks to get the toxin out because it can be poisonous. And so they have to boil it. If you don't boil it enough, if you don't prepare it well enough and your animals eat it, your animals will die, okay? And there was an animal on Guam called the flying fox. And when you're hungry, you're going to eat whatever you can to survive. So the people began eating the flying fox, okay? The flying fox was filled with this toxin. Turns out to be BMAA. It's not important what the toxin is. Just remember there was a toxin, and the toxin concentrates in the fat of the flying fox at multiple, 10, 20, hundreds of times more toxic than it would be. People eat that, and then they started to come down with Parkinson's and ALS. And that disorder, once they figured out the root cause, you talk about Hippocrates, they figured out the root cause, there hasn't been a case since 1951. So environment can lead to this. Our reaction to how we see this and how they dealt with that on Guam and how we've dealt with this with the HIV story is a path. It's a road that we can walk on. And so I think it's a very powerful example of where we need to go. But it's our turn. I think everybody in this room would say it's time. It's our time to be on that road together. But we're going to need people to sign up, sign on, and raise their voices. Because it's not going to be me and you, Ben. I know that we think that we're cool and everything, but it's not going to be me and you. It's going to be these folks that are going to make that change.
And the amount of money that's currently, even the research that's going into HIV compared to Parkinson's is still not really there yet as far as the dollars being invested, right?
It's been 10 to 15 times less over the last 2 decades. So it takes an investment. And then the other thing about the investment that's going to be important, Ben, is we put 2 to 3 pennies out of every dollar. I don't think they make pennies anymore. But when we made pennies, we put 2 to 3 pennies out of every dollar into prevention in this country. If anybody in this room thinks that is an adequate investment, please talk to me after, because I'm just, it blows my mind. This is what we do worldwide too. I think the most is like 3 or 4 pennies in any country that does this. We've got to make the right amount of investment. We've got to have a plan. We can't just take the money. We've got to have a plan for that of where we're going to put the money proportionally. So $750 million into each of those 4 pillars, PLAN. We have a plan, and we've got to proportionately put money into prevention. It's not acceptable that cardiology gets to prevention, right, with your statins and all of these things, but we're not even thinking about it in neurology and Parkinson's disease.
So turning back to the individuals in this room, I'm sure there's some people here that are newly diagnosed or their loved one is newly diagnosed. What advice do you have for them starting this process and navigating through their own health care with Parkinson's?
Yeah, so first I would say that we do it wrong when we make the diagnosis. Almost everywhere, not everywhere, and we need to teach people, what is Parkinson. Parkinson is not Alzheimer's. Everybody thinks Parkinson is Alzheimer's. We've actually asked people. We've done the study where we've asked people, what do you think when you get Parkinson disease? And so we need to make that diagnosis. We need to walk the road with you, and we need to let you know, as Larry Gifford, who's the head of the PD Avengers, which you're all going to join now, pdavengers.com. You're all going to join and become part of that movement. But he says Parkinson should be a life sentence, not a death sentence. Mm-hmm. And then there are lots of things that you can do that are really important to live a better life with Parkinson. And we have to spend time, spend money, change the system. But I'm very optimistic about the care of Parkinson, that if we do it better and we do it right and we integrate it correctly, that people are going to do better.
That's great advice. We have a couple minutes left, and I know Mike is going to be here until 11:30 signing books. But is there any questions from the audience, anything that anybody want to ask? I'll run down with the mic.
All right.
Yes.
Has any relationship between food dyes and Parkinson's been explored?
So, so the question is food dyes and Parkinson. Not a lot of information on that. However, anytime that you have a chemical, dyes are chemicals, right? So anytime that you have a chemical, you have to look at the chemical makeup, and then you have to study the chemical versus disease. So the food dyes have been associated with other things, but not so much in Parkinson. But it wouldn't surprise me at some point that we get there. I think we have to be skeptical until we get some data, but a good question.
Okay, questions back here.
Yes, I was wondering, you made the comment about the golf relationship to Parkinson's, and does the Golf Association acknowledge that relationship?
No.
And is,
Yeah, so like my wife says, every day of my life that I've been writing for the last 25 years, I become a less popular figure. And no, the pesticide industry, the golf industry, it's not necessarily a good thing, although it's your right to know. So if you are a golfer, it's your right to know when they spray the pesticide. Ask them. You may not want to play the days that they spray. You may want to know what they spray. And you may want to play on a course that has a few more weeds on it, depending on what they're spraying. And you certainly don't want your playing fields of your kids to have that. The relationship between golf and Parkinson, to be clear, in that study that was published in JAMA, is about how close you live to the golf course. It wasn't the golfers themselves. Now, the golfers themselves, as we said on NPR, I don't know why, but a lot of golfers lick their balls. They do. This went over really well with Todd Whitehurst
Golf
on
balls,
NPR.
right?
Not sure why they do that, but they do, and they put the teas in their mouth, and when they smoke a cigar, they put it down on the pesticide, and then they put it back in their mouth. So there are things that you can do, and then the water supply at the golf course, so making sure if it's not filtered, you're being careful. So you just have to be careful. It doesn't mean you have to stop playing golf, because the exercise is good.
Yeah.
I was curious, a lot of us live near the water here, and microcystins and cyanobacteria seems to be an indicator that's being studied. But the bigger question is about the industries that supply the problems that we can't really ever get to the next level, can we?
Yeah, so there's actually quite a number of sites around the United States called Superfund sites. You can look them up. This is where the government has agreed that there has been contamination. That contamination needs to be cleaned up. They monitor it really well, but have they cleaned up the site? You can have your own water checked. Probably the easiest thing to do is to put a carbon water filter. Make sure you're drinking with a carbon water filter. Cheaper than getting it checked or having your city check it. And then the question is which of these things are related? And there are about, I don't know, it's been estimated 600 times, 500 times more papers on genetics each month than there are total papers written on trichloroethylene and Parkinson's disease. So we're not making the proportionate investment to study it. So we need to study it to get the answers.
What has the federal government, as far as the Veterans Administration, doing and helping with financing any of this? I'm a 38-month veteran in Vietnam, and I feel that that's the Agent Orange is what's affected me right now.
Yeah, so when Shinseki was the secretary of the VA, they did provide benefits for people that were exposed to Agent Orange, but it took too long, and it's been too hard of a road for our veterans. We talk about in our Parkinson 25 in the book that's one of the things we need to do is advocate for veterans because they have a higher prevalence. Jerry Insminger was a drill sergeant at Camp Lejeune. Camp Lejeune has a 70% higher rate of Parkinson's disease plus other cancers too when compared to others. And a nice paper that recently was published by Ray Dorsey and his colleagues on this. And so we have to do more to protect you at home as well as when you're protecting us. And so for those of you who are here, you should know that we put our veterans in harm's way. both, for them protecting us, but also even at some of the bases and some of the things we expose them to at home. It's unnecessary. We shouldn't be doing it. And as Jerry says, and he was a drill sergeant at Camp Lejeune, and he's a proud American, and he still loves America, but very critical of the response being slow and no way, that wasn't us, we didn't do that, but now they've acknowledged. But it shouldn't have to take us all these years to recognize the veterans and get you the care that you should get, and also an apology for the exposures.
And thank you for your service, too.
Do you know how the lawsuit with the Marine Corps is progressing?
How which with the Marine Corps is progressing? The lawsuit? Was that the question?
Yes.
Yeah, I don't know the specifics about it, but I do know that they have finally acknowledged and are now starting to give benefits. But again, that gets to your voices, right? And the standard. So if you have a clinical trial on a drug, what's the standard? So we have to hold companies accountable. We have to hold governments accountable. We have to hold each other accountable. And I think it's a really important lesson.
Hi. Is there any testing that can determine how long a person has had Parkinson's?
So there's no test that can actually, that's a great question, that can tell you how long you've had Parkinson. And I should say Parkinson is not just Parkinson's disease. We talk about this in the book. It's Parkinson's disease as. And so you look left, you look right. It is one of the most, we call it heterogeneous. That means different people look different with the same disease. Even some people, even the minority of people with genes can look different, and have the same gene. And so that heterogeneity or differences also impacts how long, you have symptoms. And so right now there's this huge rush of people trying to get not just a biomarker to say you do this blood test, or you do this scan, or you do a group of these things to say you have Parkinson. That's been difficult. But what's even more difficult and important is how to track progression, and then come back to somebody like you and say, okay, based on the data that we have, this is where we think your progression pattern is going to be, and let's do this as a strategy to try to help you on this road so you can have the best lifespan possible.
Yes.
But I wanted to go back to a previous question about, is the VA funding any research for Parkinson's disease?
Yeah, so funding is an issue that's a hot button right now for everyone, because funding is going down across the board. And the National Institutes of Health was slated for a 40% decrease in its funding. It's still being fought over in appropriations, and this is, we're the largest funder of research in the United States. We need to be going up, not down, particularly in things like Parkinson. The VA has funded, particularly through related programs to the congressionally mandated program for Parkinson, which was just cut. I don't know if it's been cut 100%, but cut most of the way, a large percentage. The Department of Defense also has some funding. DARPA also has some funding. And so all of these are under severe scrutiny and cuts. And I should say the Ending Parkinson's Disease Act, the Ending Parkinson's Disease Bill, passed 407 to 9 in the House. It passed unanimously in the Senate and was signed by the President of the United States. So there's bipartisan interest here, if you raise your voices, to get that funding going. And not only do we need to get the funding back, we need a lot more funding.
And you said currently it's 40% down?
It's set for a 40% decrease at the National Institutes of Health level and across the board right now, unless appropriations is able to change that trajectory. So I think we're getting the stop signal here, Ben, so maybe one more question.
Okay, one question here, and then Mike will be out by the table signing books so we can answer more questions there.
Is AI going to help much in the future here?
Yeah, so I'm positive on AI. I think there will be some dark stories and dark alleys with AI as well, don't get me wrong, but when you have a complex disease like Parkinson, you're never going to be able to remove the human element. Okay, we're still going to need humans. Okay, so don't worry. This isn't so simple that AI is going to solve this. So you're still going to need people. You're still going to need docs. You're still going to need healthcare providers. But hopefully, you'll be able to spend more time with the healthcare providers having the discussions that matter, rather than some of the other things, the rote things that AI may be able to help you with. And then some of the things, like the devices they use at Cleveland Clinic, that are really hard to program and really complicated and are hard to scale so you can get them to a lot of people all over the world, AI is going to be able to change that trajectory. So hopefully we can do these robotic, we can take the care into your home, we can be a lot more efficient, and then hopefully we can tell you before you have a problem that you're headed for something, and then head it off. And that's the best, most integrated healthcare system we could hope for. Right now, you're just lucky to get parking and see one provider. So that has to change.
Well, thank you again, Mike, for coming out to visit us today. I think this has been fantastic. I know you'll be around a little bit before you catch your flight and sign a few books for us. And I'm sure that our group here is very thankful for your
It's been an honor to be here and to hear
work
everybody's
too.
story. Thank you for all you do.